Hello everyone and welcome to Module 3, Deep Bite Treatment. My name is Dr. Sandra Kong Tai. All over the world, wherever I lecture, many doctors come to me and the most challenging malocclusions that they find it difficult to treat is deep bite malocclusions. So today we're going to spend some time looking at how to treat deep bite malocclusions successfully. Let us start by discussing the innovations for deep bite treatment. All through the course, you will find there will be an emphasis on diagnosis, treatment plan, ClinCheck design, and then clinical execution. So let's start off with our diagnosis. A deep overbite may be caused by the following three factors: upper and lower incisor inclination. Sometimes your upper and lower incisors are both retroclined, and that leads to a deep bite. Hypererupted maxillary incisors. You can see that when the patient smiles, the incisors are hanging down, there's excessive gingival display, and a deep overbite. And finally, a common cause of deep overbite malocclusions could be a deep curve of Spee in the lower arch. The diagnosis is vitally important in determining what type of treatment mechanics will be employed to correct the deep overbite. So there's several innovations for deep bite correction. Pressure areas and optimized deep bite attachments are designed to level the curve of Spee by improving control of anterior intrusion and premolar extrusion for more predictable deep bite treatments. With the G7 innovation, now there are optimized support attachments that are designed to support incisor or canine intrusion. And finally, precision bite grams are designed to disclude the posterior teeth for improved efficiency in deep bite treatment with Invisalign clear aligners. So now we're going to look at every single one of these innovations in greater detail. Now, we've always known that aligners are very good at intruding teeth because of the principle of aligner engagement. There's aligner material wrapped on the lingual, the occlusal or the incisal, and the labial of the tooth, and mesial and distal. And so when the tooth is completely engaged by the aligner material, it's able to exert that intrusive force very well, particularly because of aligner material on the incisal or the occlusal surface. However, many clinicians like you and me who have been treating deep bite patients for many years have realized there's still an issue with correcting deep bites. This is because biomechanical testing showed that the intrusive force from the aligners may not be directed along the long axis of the anterior teeth. So they came up with the innovation of pressure areas. What are pressure areas? Pressure areas is a concavity on the lingual surface of the aligner, so that when there's an intrusive force directed here, the resultant force is going to occur along the long axis of the tooth for more predictable intrusion. And pressure areas are available for incisors and lower canines. The second innovation we want to talk about are optimized deep bite attachments. Now, optimized deep bite attachments look a little bit like this. They look like a little shield. There's a convex surface on top and a flat activated surface on the gingival. They can be passive or active. When you select a prescription that says anterior intrusion only, these optimized deep bite attachments are then placed on probably one of your lower premolars to provide anchorage that's needed for anterior intrusion. The more severe the deep bite is, the more anchorage you're going to need. And so in extreme cases, you might have an optimized deep bite attachments on two lower premolars, as well as horizontal attachments on your first molar as well. Now, when you go to the prescription form and you click the box that says anterior intrusion, posterior extrusion, then these optimized deep bite attachments become activated. They're activated so that an extrusive force is built in to push against the active surface of the attachment, and when the aligner is fabricated, there is a small space on the occlusal so that when the tooth extrudes, there's going to be a space for the tooth to move into. And this is the difference between using an optimized or activated deep bite attachment as opposed to using a horizontal rectangular attachment beveled on the gingival. A conventional attachment has no activation built into the aligner. The third innovation are precision bite rams. Now, these precision bite rams are prominences on the lingual surface of the upper aligners. They're not filled with composite because we are using a digital orthodontic appliance. And in a digital orthodontic appliance, the precision bite rams are automatically customized for each patient and each aligner stage. The depth of the bite rams are up to 3 millimeters to accommodate an overjet. They're not able to fabricate the bite rams larger than 3 millimeters because of limitations of manufacturing and of the material. And here's the very interesting thing. The bite ram position is automatically adjusted to maintain anterior contact throughout all the stages of movement as the lower incisors align. Now, when I used to use fixed appliances, I would bond metal bite turbos on the lingual of my upper incisors to disclude the occlusion so that in a patient with a